So welcome to the September MAC meeting. I'm sure that we all know how to join Zoom now, but just so you know that once you registered, the email was sent to you and you can call in on your phone or join through the app. Next slide. And at the bottom, you can see all of the icons. We ask that you turn on your video if you're speaking. That way it makes it easier to understand. You can also check to see who else is in the meeting by clicking on participants. Also, if you have any questions or comments, please put them in the chat. At this point, we ask you to put your name and your organization in the chat so that it helps us with minutes and just keeping track of who attended today. So if you wouldn't mind, go ahead and put your name and organization there. Next slide. And just to underscore mobility, the Mobility and Access Coalition really focuses on transportation equity. So we believe that transportation is one of the social determinants of health and that it's essential for people to access all other aspects of their life. We think that transportation leads to access to opportunity, quality of life improvements, and people being able to meet their basic needs. We do take a multimodal approach, which means that we focus on different transportation options, not just one option. Next slide. So this is our agenda. We have a pretty full agenda today. We'll do brief updates at the beginning, and then we're going to head into a health and transportation panel discussion, which I'm really looking forward to. So we have some wonderful guests on today. I see that some of our panelists have already joined, but we'll go ahead and start with the updates. Next slide. I'll hand it over to Jessica for this update.
Yeah, thank you. So for the last, I'm going to say 8 months or so, I've been working on the Mobility Heroes campaign. This is a bilingual campaign that celebrates the drivers that we voted for at the end of last year, who are drivers from our region, from different organizations. So the 6 winners of this year's Mobility Heroes campaign are on your screen. We have a series of images and videos that we're going to post on social media to boost this campaign. We have representation from RTD, VBSD, Cultivate, Vets Go, C-Trip, and Via Mobility Services. If you want, I'll share here in a little bit the 2 YouTube videos and our posts on Facebook, Instagram, and X. I'll also send here or how you can follow us on social media so that you don't miss this campaign. We want to just show and share the information of what our partners are doing and then promote this this career that includes, you know, drivers that are paid, but also volunteer driving opportunities in the county. And part of this celebration too, next slide, please, Maya, is to have an actual physical celebration where we're going to have our heroes who were nominated. And I briefly talked about this last month. So I created a monkey survey where you can choose a date to join this winter celebration. Of course, everybody is invited. And I think we have 6 different options, a couple in November and the rest in December. The survey is very, very quick. It's just what's your name and what dates work for you. So it shouldn't take you more than a couple of minutes, maybe. I'll also share the link in the chat, but hopefully you can join us. There will be free food. There will be an opportunity to meet our mobility heroes and then also learn more about what we're doing to promote these careers. Does anybody have any questions? I can ask, I can respond, or you can also leave them in the chat. But yeah, very excited to have launched this campaign and then also have an opportunity to celebrate. Thanks.
Hey Jessica, I'm just double checking that you want people's first and last name on the survey, or just first?
First and last name, yes.
Okay, it just says first and name, so I think you just
Oh.
word, but yeah, I gotcha.
Okay.
Okay, thank you so much.
Yeah.
Yeah.
Well, thank you. And it's really great to see all of those videos that are coming out. So definitely keep an eye out for your favorite drivers and your favorite providers, and share on social media and really help spread the word about all the amazing work that they do. And thank you, Jessica, for taking the lead on this. It was really a thoughtful, well thought out campaign, and just can't wait to see the whole thing in its entirety. Next slide. Okay, next I'm going to go ahead and turn it over to Melissa to give the update on Walk and Roll the School Day.
Yeah, so actually I think Amy is on the call. If I welcome you to chime in. But I reached out to both Amy and then Teresa Spires from St. Vrain Valley School District to see what, events are upcoming for the schools in our area. And Teresa shared with me, and I can share with the group, that they hosted a bike train event earlier this year and had like a pretty great turnout, and it was really exciting to hear that that's what they were working on. But Amy, if there's any events that you know of from BVSD that you'd want to share with the group, that's also welcome.
Sure. Yeah, I can just chime in and say we're also celebrating on Wednesday, October 9th. We typically have like 35 to 40 schools within our school district participate. They typically just have music and hand out snacks and giveaways before school, sign a banner, that kind of thing. We have a few schools doing special events like bike trains or walking school buses, and a few bike rodeos. We've been doing bicycle education at Heatherwood Elementary last week and this week, getting those kids ready to ride their bikes to school. So yeah, a fun event that we look forward to every year.
Yeah, awesome. And then I just refreshed my memory on the school that did the event from St. Vrain, and it was Mountain View Elementary School, and Mr. Bike Night, Ryan Craigard was there, and it was like a bike safety rodeo, bike train type of thing. So yeah, sounds like some fun coming down our way.
Great, thank you. Does anybody else know of any other activities that's going on for Walk and Roll the School Day? I know that somebody else might be hosting a bike train or festivities. I don't see anything in the chat. If you want to know more about how to participate, just go ahead and reach out and we can connect you with some of the toolkits for it. Thank you, Melissa, for the update. Next slide. Mm-hmm. So I'm not sure who was going to oversee or give this update, but there are a couple different e-bike incentive programs that are launching. Actually, they launched yesterday. So you've probably heard in the news and even on the national news that some of our local and state e-bike incentive programs have been very successful. The city of Boulder launched their incentive program yesterday, and then the Colorado Energy Office also launched theirs yesterday. So it's we just ask that you share it with your networks. I sent an email out last Friday that Jessica had drafted for us to share with our networks. So if you know of anybody who could benefit from some of the subsidies for e-bikes, please direct them towards those two programs. Does anybody want to add anything else out? I know that like Sydney's on the call from the city. I don't know if you have any other updates.
Yeah, thanks, Angel. One thing with the City of Boulder e-bike incentive is that it's for income qualified only this time around. So that means you need to have an income that is at or below 80% AMI. And then you also need to be a resident and live in the city. So those are the two qualifications. There is a little bit more money for people who have 60% AMI plus. So yeah, let us know if you have any questions.
Great, thank you, Sydney. I think that the Colorado Energy Office one is also income qualified. Is that right, Jessica or Melissa?
I'm gonna double check right now. And I think Gabrielle is asking 80% of what? What was that percentage?
Yeah,
AMI is area median income, and to answer your question, Angel, yes, the state one has a mid income and a low income bracket that you could qualify based on your income.
yeah, that's great. Did that answer your question, Gabrielle?
Thank you. That answered my question. I just didn't hear the acronym.
Great, thank you. Okay, it's great to see so many e-bike incentive programs moving forward. Next slide. Okay, so Boulder County hosted a transit public meeting, and I know Paul, I saw you join the call. He led that effort. We had a survey that we were collecting feedback on. We got 45 responses so far. And so I don't know, we haven't made the decision if we're going to keep it open longer, or if we're going to transition. I think that we were a little bit light on Ride Free Lafayette surveys. We'll go ahead and put the link in the chat. So if you all know of anybody within the next day or so who would be able to provide feedback on Ride Free Lafayette, that would be helpful. I know that there was a pretty decent number of people who responded to the Lyons flyer portion, and then some people who responded to mountain rides. Paul, I don't know if you want to add anything else to that update.
I would say that I led the effort would be kind. Angel, you led the effort to help me have that meeting. So if anybody was on the meeting, thank you for attending. I appreciate the time to share with everybody the transit services that Boulder County is providing, and would really appreciate any feedback that we can get in the form of surveys, so we can make sure that we're communicating and accepting all ideas for how we might plan our future together. So thank you for that.
Great, thank you, Paul. And Jessica put the link for the survey in the chat. I can also forward it to the group after the meeting so that you can forward it to your networks. Cami?
Yeah, and just to clarify, is this for anybody to fill out the survey if they might use these services, or you're really looking for like local residents to give feedback? Just like, who are you looking for to answer the survey?
Yeah, that's a good question. I think anybody who would use the services, right? I mean, so if you would use Lyons Flyer from Boulder to Lyons to like go for community events or something, then we definitely would want to hear that as well. There is, in general, like there's like what's going well with the service, what do you suggest improving? So it's really focused on like, where can we go next? And just for those of you who weren't able to attend the public meeting, we're really trying to get into a cadence of doing routine service changes because a lot of our services have been pilots or ad hoc. And so we've just been making service changes based on like requests that maybe don't come in like consistently. So we just want to make sure that we are holding public meetings and listening to what can be improved or what people would like to see for the future, so that we're being more equitable. And so everybody knows like those times of year when people can provide feedback. And we've decided to time them with RTD's service changes as well. That way people don't have to remember 2 different service change schedules. Did that answer your question, Cami?
Yeah, thank you for the clarity. Really helpful.
Thanks. Any other questions on the Boulder Transit Services? Okay.
Oh, just one question in the chat about whether if it is available in Spanish too. And I believe it is, right?
Yeah, it is. Yeah, in the upper right-hand corner, you can select Spanish. And then, yeah, all the links or all the content should be in Spanish. Thanks for asking, Aurora. And another highlight that we talked about during that meeting was the Boulder County Strategic Transit Plan. So we didn't talk about it too much, but just so you all know, starting early next year, there's going to be an 18-month planning process to really look at what is the existing transit system, what does it look like in Boulder County, and what are those areas where we want to invest on the local level to make sure that we are supporting our local transportation needs as well. So And Alex Hyde-Wright, he's the, I think he's going to be the project manager for that project. There's also a link in the email that I'll send you where you can watch the video if you haven't already. Okay, next slide. Okay, so next we have an update from our very own Accessoride Queen, Sarah Lee, who recently was appointed to the RTD Accessoride Passenger Advisory Committee. So turn it over to you, Sarah, for the APAC update.
Awesome. Thanks, Angel. I love how everybody calls me the Accessoride Queen. That makes me laugh. But yeah, I want to be, though. If there ever is that title, I want to like be in the coronation for it. But yeah, it looks like my slide that I made didn't make it, so I'm gonna put the text in the chat just so everybody can look at the chat. But I recently got appointed to the Accessoride Passenger Advisory Committee, which has 11 members currently. It's capped at 13, so if anybody else wants to apply or knows anyone who wants to apply, they'll take 2 more members. Terms start in September, and end in August, and they're 3 years long, so it's a 3-year commitment. And members contribute to discussions and ideas about Accessoride. It's not a place for complaining or, it's a place for improvements, and chatting about different ideas and different things that aren't working so well, but more so chatting about things that could improvement ideas or things like that. And then the meetings are held every other month on the second Tuesday. And then the discussion, the meetings are joint with the APAC. Every other meeting is joint with APAC and ACPD, which is the committee for accessibility with like regular RTD transit. And then my next slide, I'm gonna grab that text real quick. I have a QR code, but I can't put that in the chat, so I'm just gonna put the link. Hang on, sorry.
Sarah, I'm showing your slides too, so
Oh,
they
really?
can see the QR code. Yeah.
Oh, awesome. Thanks, Maya. Sorry. You are? Okay.
Oh, I don't know if I see it, Maya. You might need to unshare and then share your new, the other PowerPoint.
Sorry. I don't know. I edited the thing, but then technology was telling me it's a read-only file. You can't edit. And I was like, what? I just did. Okay. Thank you. That's perfect. That's perfect, Maya. Thank you. Those are the slides.
Yeah, sorry about that.
No, you're good. It's not you. It was my computer being dumb. But yeah, no, you're totally good. But yeah, there's a QR code, and then there's also a link that I've also put in the chat. But we talked last time during APAC about the Access on Demand peer review. And RTD said they were concerned about the sustainability of Access on Demand. With the numbers, they're saying it's costing them $1.2 million per month to use Access on Demand. For those of you that don't know, Access on Demand is like Uber and Lyft. The first $25 off of Uber, Lyft, Z-Trip, and Metro Taxi is covered by RTD if you need an on-demand trip. And then the numbers are 2,800 customers are using Access on Demand currently. And then you can download the PDF report and you can leave feedback webpage. And the survey, I think they said they're running it until November. I don't know if that's when, but they either cut it down for month. Right now it's 60 and / or cutting it cutting the cost and making it so that you pay a little bit beforehand. And then maybe it's a little bit more per trip. It's maybe 35 up to 35 per trip. But you can weigh in on your thoughts. It's really encouraged. They're really looking for ideas and just different ways to think about it. So if you have some innovative thoughts, ideas, put your thoughts in that chat, in that text box in that website or the QR code. But thanks, guys. That's it for me. If anybody has any questions, let me
Great,
know.
thank you, Sarah. That's really great. And as Sarah mentioned, the not a ton of people, or not everybody's using the Uber and Lyft that is also an Accessoride customer. So it's really important to know like scalability of it. Okay. Well, that'll be it for our updates. We're going to transition to our panel discussion, I believe. Maya, you want to go to the next slide? So we have some wonderful
Hey,
guests.
Angel, I think there's a question for Sarah about how to apply to be a part of the committee.
Oh, wonderful. Sarah, do
Oh,
you-
it's a great question. I will put the link in the chat, but there's an application. I would recommend, like, Angel and I worked on like a Word document first, because you can like work on a Word document and answer the questions. There's questions that you can answer, like what would you know, what improvements do you think you would want to make to Accessoride? Like, what would you want to change? What do you like about Accessoride? Stuff like that. I'll put the link in the chat, but it's on the RTD website.
Great, thank you so much. Great. And I saw that Stephanie wanted to have the link for the Mobility Heroes. So definitely vote if you want to attend the Mobility Heroes celebration this fall. Okay, so as we mentioned at the top of the meeting, we really believe that transportation is a social determinant of health, and this forum is really about cross-sector connections to make sure that we're having human services providers talk to transportation providers and planners, and healthcare and health access is one of those areas where I think we had talked about, we want to make sure that we have stronger connections with those communities, those organizations. So we have a wonderful group of panelists today. We will leave this screen up just until we're done with the introductions, and then we'll go ahead and stop sharing the screen so that you can see their beautiful faces. So I think that Matthew was going to be a little bit late, unless he's here. Matthew, are you here? Yeah, okay, so we'll wait for Matthew. So if my staff could keep an eye out for Matthew and let me know when he joins, that'd be great. So we'll go ahead and start with Lizbeth, Dr. Mendoza. So basically the first question is, can you please introduce yourself and really like what your organization does and who you serve?
Yes, hello, good morning. Thank you for having me here. I am Lizbeth Mendoza. I am from Boulder County Public Health. I'm specifically working in mental, behavioral, and health branch of the Strategic Initiatives branch. And what we do is trying to find, ways of connecting different, first of all, communities with the policy, production or reviews, but mostly our strategies as an agency. What are we doing to connect? Are we serving, and so on, in between also departments, but also with the communities. And in my case, it's particularly for mental behavioral health.
Great, thank you very much. So next we have Sadie, and Sadie is representing Boulder Community Health, and she works with the trauma center there. So Sadie, would you like to introduce yourself?
Yeah. Hi everyone. Thanks so much for having me and for the invite, Angel. So I am I'm a nurse by trade, so I work for Boulder Community Health. I am currently our trauma outreach and injury prevention coordinator. So Boulder Community Health is a level 2 trauma center. There's 3 levels of distinction with trauma in the healthcare, level 1 being the highest, meaning you treat kind of the most critical of trauma patients. And so we are a level 2 facility. And so part of my job is injury prevention. So I look at our trauma registry. So kind of the list of trauma patients that we see at the hospital, and really look at our top 3 mechanisms of injury, and then kind of create a community education plan for those top 3 mechanisms of injury. So primarily what I look at are older adult falls, motor vehicle crashes, and then bicycle crashes as well. And then I also do our trauma outreach. So I am out in the community kind of doing these community programs, and then also just supporting our trauma survivors network, and kind of the mental health of our trauma patients.
Great, thank you so much. Next on our list is Daphne McCabe, and Daphne works for public health. I'll let you introduce yourself. So your introduction, what your mission of your organization, and who you serve.
Sure. My name's Daphne McCabe again, and I am the Family Health Division Manager. And the mission of public health really is to make sure that we look at health as a population phenomenon. So what can help us lift the overall health and well-being of community members at all ages and stages of life. With the Family Health Division, we are especially focused on ages basically prenatal to 5, and children with special needs, which Aurora will speak to specifically. On the team, we have WIC, which some of you may have heard of, which is Women, Infants, Children. And it's really about food access and breastfeeding and the infant years and the toddler years with food for the family. And we have registered dietitians on staff for that. Then we also have the Nurse Family Partnership, which does home visiting for families with infants who are in the kind of below the poverty level range for the most part. And they have to be first-time parents. Then we also have the Child Health Promotions, which works on, among other things, a lot of early childhood education, so childcare access, and among that we also do farm to early childhood work, so again, food access. And then we have the Family Connects and Children with Special Needs, and I'll pass it off to Aurora for that.
Wonderful. Thank you so much, Daphne. So Aurora, sorry to interrupt.
No worries. So my name is Aurora Ramirez, and I'm the Community Alignment Coordinator for Family Connects and Children with Special Needs. And like Daphne was mentioning, so for Family Connects, we serve babies that are 0 to 3 months old. And then for Children with Special Needs, we serve kiddos that are 0 to 21. So that's the bigger range for that. And like Daphne mentioned, we are looking to see how we can help improve the accessibility especially for our special children with special needs as well. Did I get everything? I think I got everything.
Yep. Yeah, I think so. Thanks. And I don't see that Matthew's joined yet, but Matthew will join the conversation when he's able to, but he is with Healthcare Policy and Finance, and he oversees the non-emergent medical transportation program with TransDev. So if people are Medicaid members, Health First Colorado, they can call and get transportation to medical appointments. So looking forward to having him join us as well. So we'll go ahead and we're going to rotate through different people answering first, but I think some of you had already alluded to this in your introduction, but really if there's anything else you want to add, that would be great. I'll start with Sadie first. So in particular, what role do you think transportation access can play in addressing health disparities with different communities? You talked a little bit about like older adults driving and trauma. So I don't know if you want to speak to that a little bit more.
Really what I, a piece of what I've noticed is kind of something probably that Matthew can speak to a little bit better than me, but just kind of getting patients to follow-up appointments after maybe a trauma or a fall or something that has happened. So I think that is just really an an aspect of kind of trauma care that we do see lacking in certain of our populations. One of the other things that I have noticed is in kind of the injury prevention role is just, a large part of my job is doing the community education for older adult falls. And we tend to go out into the community and try and partner with community centers and senior centers. And oftentimes we do get the feedback that, we're offering classes at times when maybe transit is unable to take them to the community centers, or maybe transit has changed in their area, and so they're not able to get out regularly, which kind of leads to older adults being more isolated and ultimately increases their risk for falls. I do see that increasing the access for transportation, especially in our older adult population, can just have a huge impact on their health disparity.
Yeah, wonderful. Thank you. It really is important. I always say that we don't think about transportation until it's broken, right? And so if people, if they fall, then their transportation's broken. They can't necessarily drive themselves. So Daphne, the same question, what role do you think in your professional experience that transportation access plays in addressing health disparities for different communities?
What we notice is that the not having adequate transportation can increase mental health because of isolation issues. And then we also notice that it can increase food insecurity, because getting food often requires or usually requires transportation of some sort. And it's worth noting that starting in January of 2025, HCPF is going to, with the new contracts and the new cycle, is going to allow for prescriptions of food, recognizing the importance of food. So given that food can be medicine, then I'd say access to being able to get there and get what you need, and then also access to recreational opportunities like parks and getting out and enjoying and healing our bodies, or just enjoying our bodies as babies grow and need access to playgrounds as toddlers.
Yeah, great. So Aurora, from specifically like your vantage point with kids with special needs, like what role do you think that transportation plays for the people you serve?
So transportation, I feel like it could access or transportation access can improve the ability to attend medical appointments. And it was one of the identified barriers from a lot of our families that mentioned that oftentimes they didn't have a ride, or they weren't able to get bus or IntelliRide or Via Ride to their appointments, all the way up from like Boulder County all the way up to Children's Hospital. So that's the part that I would add to that.
Yeah, definitely. I think that we've heard that before, like since you need that specialized medical care, like the Children's Hospital network is not necessarily easily accessible from Boulder County by transit.
Right.
So that's really important to consider.
Yeah, and then I would also mention that from the Family Connects point, access for our new parents or our parents who have a new baby to be able to get to their appointments, their follow-up appointments, their child checks, all of that as well.
Yeah, wonderful. Thank you. So, and next, Lizbeth, how do you feel from like a mental health standpoint? Like what do you see like the impact that transportation access can have on the people you serve?
Yes. Well, I mean, it goes to one of the basic needs as, humans, connection with others and being an accessibility. So when it comes to equity, we know that some populations are usually left behind, and you can even visualize this in transportation, or are isolated, are not included, have all kinds of trouble being, having access to stuff. And transportation is one of those things that help people connect to whatever. It can be as simple or as obvious as going to take your therapy. If it's difficult for you to access to your therapist, probably you're going to drop it, mostly considering that you have much other things happening in your life. Or you will be not motivated, like, well, if I got a therapist that is somewhere that is super hard to access, it's going to take extra time for me to get there. No, I probably won't do it. I get more stressed. So it is life, having the capacity of accessing stuff easily. And also, even the other aspects like improving, like other determinants of health, has been mentioned before, like accessing to food, accessing to better places to go study, work, play, all that stuff. Everything kind of like insights in holistic health, and health is not just physical health, but it's also mental health and then social health. So having transportation kind of like hits on all these three aspects of what is health in one. Mm-hmm.
Yeah. Can you, so the three aspects of what is health again, can you repeat those for?
Yeah, it will be like physical health,
Uh-huh.
it will be mental health, but social health as well. And that's when that connectivity kind of like takes a lot of meaning. And also, I don't know if you guys have seen, sorry about saying guys. I just learned that I shouldn't be saying that. I don't know if you have seen or heard about how the CDC identifies introducing and expanding public transportation as a key evidence intervention for increasing health in general, because it has been proven that this is a strategy that will improve health in less than 5 years, and it will be also cost effective. So if interested, I can just circulate to you some of that information. So it is well recognized by even by the CDC's. Transportation is a key component of health.
Yeah, that would be great. Well, if you want to give us the link, we'll include it in our follow-up newsletter that we publish every month after the MAC.
Yes.
It's great to see like that, that it's already well established, that it's a good intervention within 5 years. I hadn't heard that before. I'm learning all sorts of things. Daphne talking about food being medicine, and like you talking about transit being the key to health. That's great. So the next question I have is really about oh, sorry. Did you speak up? I thought I heard somebody. Okay, sorry about that. Okay, so how can transportation policies, and this may not be like transportation policy is probably not your expertise, but how do you think from like a public healthcare professional that transportation can be aligned to help reach health goals such as reducing air pollution that lead to poor health impacts, or just really like getting people active? I don't know. We'll go ahead and start with Daphne. I know that, yeah.
I'm so sorry. I had a little thing pop up that I had to, can you say that question?
Oh,
again?
yeah. So how can transportation policies be aligned with public health goals to reduce like air pollution or get people moving? Like how in your mind can transportation change to meet those goals?
We were thinking about policy, and specifically, we were curious if there could be ways in which the transportation group could work with maybe the school districts on their buses, because their buses are also available but sitting still, and have the ability to maybe do food access work during the day if RTD is already stretched too thin. So I don't know that that's a policy or if that's a implementation, but we felt like there could be sort of infant friendly or food shopping friendly policies, and for us it's things like parents who have to collapse the stroller before they get on the bus. Could that possibly be looked at, or could there be certain types of buses that allow for more child-friendly and infant-friendly transportation? So those were some of the things we were thinking about. This policy and transportation area is not our area of expertise. So
yeah.
Any other ideas, Aurora? You might have some with the children with special needs.
No, I think you pretty much hit the point regarding policies. Yeah, no, I don't think I have anything else to add to that, other than I know that MCH is also working on safe connected transportation system, like I think it's a strategy that they're doing. And funny enough, I just got off a meeting with them about 2 hours ago, that they were talking about implementing policies and doing a survey where they can, support the work that's already happening here.
Yeah.
And
Yes.
you also had an insight on neurodivergent
Oh,
policy.
it's a copy? Yes, thank you. So some of the things that we've noticed too is that it'd be nice if buses offered some kind of maybe time frame or something where neurodivergent kiddos who have special needs like ADHD or autism would be able to ride on the buses and not have to worry about getting sensitive to the light or the noise in the bus. So thinking about how we can have our families who have children with special needs be able to ride the bus and get to the store or get to where they need to go without feeling like they can't use the bus because there's a lot of noise and they know that their kiddo is gonna end up having some sort of meltdown or something like that.
Yeah. Yeah. I think that that's one thing that one of the inadvertent benefits, I guess, that I've heard of electric buses, like electric school buses, is that they are quieter, but then also you have, especially for kids, you have other people on the bus. So I could see that being an issue. And I know that there are some people who can qualify for paratransit specifically because there's fewer people on the bus if they have like neurodivergent needs as well. But that's a good point. So I think, Lizbeth, so when we're talking about like how transportation policies, and I know that you all aren't transportation policy experts, but in your mind, from an outsider perspective, fresh lens, like how can transportation policies be aligned to support public health goals, either to reduce air pollution, or to help get people more active, or like just in general, like what specifically do you see as being a benefit, an area that we could improve?
Yeah, no, there are a lot of benefits. Yeah, definitely that of like, reducing, like, for instance, injuries associated with vehicle use. That can be one thing. And this is a serious problem, public health problem, vehicle accidents and all that is associated. Definitely with pollution, anything that can, kind of like, again, what we are, I'm not an expert, but if there is a way of measuring, how much, using the public transportation can diminish the rate of like, kind of like, oh my God, I forgot the name, but like, becoming acute cases of asthma or other associated diseases that have to do with pollution. Not that asthma is due to pollution, but because of the concentration of certain substances in the air. But, things that can be measurable, how like increasing transportation can diminish the appearance in emergency rooms of these cases or the prescriptions. And that's just one thing that is like super basic. One thing, and I don't know if and this is something we learned during the pandemic, the people who need to stay at home, it sounds weird, but homebound people, this was a big deal because there is no such a thing as, a transportation route only for people who are homebound. And hence, it was very difficult to get them vaccinated and to access to them. And so, it makes me think, is there any way to see how how guys you can, how you can do that, like, within your routes, identifying our data of people who are homebound, and how can that be somehow incorporated into the route? Like, we know in this neighborhood, we have a lot of people who are homebound. How about we bring more transportation in that area so that the caregivers can get there easily to take care of them? Because that's a big issue too.
Yeah. And what I'm hearing a lot is like that need for collaboration, right? Daphne had mentioned that there might be unutilized or underutilized vehicles that we could use for like health purposes. And then you're also talking about really like identifying who are those homebound folks, which that would be like cross-sector collaboration, right? Like working with those human services organizations that know who is homebound to inform the planning. I like that.
There's
So
one more
Oh.
thought as Lizbeth was talking, you know, focusing again, Lizbeth, a little bit more on the older populations there, back on the younger, when you specifically talk about reducing pollution, there was, and I don't know if this could be underneath the purview of you all, but there, for a while there was some pilots with the bike to school, and there was like on the helmets, they'd have a reader and they could ride underneath the scanner and get point systems. And so it kind of became kind of a gamified way to increase bike rides and walking to schools, which maybe that increases accidents. So I'd have to defer to the BCH person on here about that. But if there are ways that you all could look at rewarding kind of the choices when people make the behavior choices that you want with taking public transportation, that's just an idea.
yeah, wonderful. I'm going to phone a friend on this one. So Amy Thompson and Cami Edson are on the call, and I know that they're both experts in this gamification of multimodal access. Amy, do you want to go first?
Sure, yeah, we still do have an active trip tracker program where kids earn Monopoly type dollars to spend in local partner businesses or to donate to their school or local nonprofits. Last year, we awarded like $73,000 in trip tracker bucks to, we have 40 schools participating now. So we do have a nice little program that gives kids an incentive to bike, walk, carpool, take the school bus or RTD to school.
And Amy's with BVSD, so that's the BVSD like program. And I don't know, Cami Edson used to oversee the trip tracker program for St. Vrain Valley School District when she was with the county. Cami, do you want to speak to that a little bit from St. Vrain's perspective?
Yeah, I'm assuming, yeah, Teresa isn't here, right? I think you passed on one of her messages earlier. Yeah, so the county was running it in St. Vrain for about 7 years, and they've transitioned it to St. Vrain Valley School District, and it's being managed through their wellness department. Teresa Spires, who was mentioned earlier about hosting a recent bike rodeo at Mountain View Elementary School. So they're getting the program up and running again through the district kind of after COVID. But the whole point of incentivizing kind of positive behaviors, I mean, it works in one way because people get to pick their own reward. It's not a pre-prescribed reward, so we like that. And then it's supporting local businesses based on healthy decisions. So, I mean, I think it's a really cool win-win model. It's something that agencies could do on their own with staff. It doesn't need to be limited to kids. So just an idea that the concept is out there that other folks could consider using within their systems potentially too. So I'm sure Amy or Teresa or myself would be happy to talk in more detail with anybody who might be interested.
Great, thank you, Amy and Cami, for chiming in your area of expertise. Sadie, from your standpoint, I mean, I know that there's like some potential collaboration between Trauma Center and then Vision Zero, perhaps, but like, what do you think? How do you think that transportation policies can be changed to align to support like trauma victims?
Yeah, you know, I think what we see in our very active community, and not just in Boulder County necessarily, you know, kind of across the state, is that bicycle crashes and pedestrian collisions with motor vehicle crashes as well. You know, it is a huge area, kind of a public health emergency, if you will. I think just kind of looking at our policies, you know, we really need to just be mindful when we are planning for, you know, new traffic patterns, or we're planning for new road development, or, you know, things like that. Just how many vulnerable road users we have in and around Boulder County. You know, we see about 12% of our trauma registry each year are bicycle crash patients, and about another 12% of our trauma registry is motor vehicle crashes. And those are kind of separate from each other, but some of them do intertwine. So, you know, I think when we look at policy, I think we really do, if we're looking to make a more meaningful impact with like bicycle crashes, you know, I think we do need to go to a legislative level. And I think we need to start looking at kind of the causes of some of these accidents or these crashes, where they're happening, and how we can kind of do better.
Yeah, that's great. And I'm not sure if everybody on the call is familiar with Vision Zero, but it is reassuring to see so many local municipalities and Dr. Cog. I mean, I see Cole's on the call as well. So Dr. Cog has a Vision Zero regional policy or goal. And then also Boulder County, we're doing our Vision Zero action plan. Cami is working on a Vision Zero action plan for the city of Longmont. The city of Boulder has had one for a while. And then the one with the county, which Liv Lewin is leading for the county, that one also will address Superior and Lafayette's Vision Zero goals. So hopefully we're moving in the right direction to where we're like thinking of them as vulnerable road users. But thank you for that.
And the only other thing I wanted to add, Angel, is I think you're absolutely correct that we're so fortunate in Boulder County to really have so many organizations working towards this. You know, even organizations like Bicycle Colorado, you know, I know they partnered with like Craig Rehab Hospital and got a distracted driving bill passed. So I think we are starting to kind of see that intersection between healthcare and kind of these advocacy organizations really making that policy change. So it is really exciting.
Yeah, great. Thank you. So we're going to go ahead and move on to the next question. And Aurora, I'll probably start with you. So in what ways do you see that public transportation can be designed to better serve populations with chronic health conditions or disabilities? In particular, I'm sure like kids with special needs and special disabilities is probably where you have insight.
Yeah, definitely. So kind of piggybacking on what I said earlier about having some kind of sensory friendly time during the bus, or for example, for families that are they have, you know, a toddler or a baby and they have their kiddo with special needs with them, I think it'd be a little bit hard for them to be traveling. And, you know, on the bus, you have to collapse your stroller. So now you have to carry your toddler or your infant and, you know, have to make sure that your kiddo who has a special need is taken care of and it's not maybe causing a distraction or maybe getting overstimulated by all the noise or everything that's going on around them. So I would say that would be a significant change. And I feel like our families from children with special needs would access public transportation a lot more if they had some sort of like aid around that, if that kind of makes sense.
Yeah, thank you. I see Marina has her hand up. Would you like to respond to what Aurora was talking about?
Hi, everybody. I have a question, Aurora, about that. I have a grandson who, you know, it has mobility issues after 17 pelvic surgeries. So he's slow walking. And so one of the challenges he has of taking the bus that he has shared with me is that sometimes he's not fast enough to when a bus came. If he doesn't arrive there on time and at least 15 minutes prior, you know, they just come and go. And it's been more than once that he has to, you know, try to walk faster. So I don't know if there's a solution for this, but if there was something that we could think about, so those who have slower mobility and it's not obvious because he's a teenager, he's 22, he looks normal, but he can't walk that fast. So I'm just bringing that out. Not that you need to answer this, Aurora, at this time, but this is a sort of a family concern. You know, we don't let him get the bus because he gets very anxious about not getting on the bus on time and that kind of issue. So I'm just bringing that out there for us to think about that kind of people with disabilities.
Yeah,
definitely. Yes. And then another thing I guess I would add to that is, you know, feeling that anxiety of saying, oh, I need to be fast, or what if you get on the bus and there are no seats available? And how do you ask somebody to give up their seat for you because you can't walk?
Exactly.
Or, for example, I know when I used to ride a bus, they would call out the next bus stop, but it wouldn't necessarily come up on like somewhere where you could read it. So my mind was going, okay, so what if somebody is hearing impaired and they can't hear the next stop? So just making sure that the inside of the bus or the accessible ride is in working order so that we can have a little bit less anxiety for those that are riding it.
Yeah, wonderful. And it looks like RTD put a link in the chat as well around around buses. And then also it looks like Sarah wants to chime in. I'm assuming it's because she wants to promote Accessoride because she's our accessory queen.
Thanks, Angel. Yeah, that and also what you were saying, Aurora, about like the deaf difficulties for like the transportation, being able to tell like can you like let me know which stop. You can always ask the drivers too. You can like, I don't know if they're able to communicate, but like you can always write it down or ask the drivers if you can communicate, like, would you please let me know when I'm at this stop, in a certain way. I don't know how the drivers would let if you're hearing impaired, because I don't think they can like get out of their seat. But we were discussing that at APAC. And yeah, also I can send Accessoride info to whoever's interested in applying, because I think that would help for your grandson's situation.
Yeah, thank you, Sarah. And the bus, there should be like a written name of the next stop on the what is it called? I'm like blanking on it.
Like the screen in the front.
The marquee type thing. Yeah, there we go.
Yeah.
Marquee,
Yeah.
thanks. Yeah. So they should also say it and also like have it written. But go ahead. So I think we just started with Aurora on that one. So kind of circling back to Lizbeth. So what do you think transportation, or how can transportation systems be designed to better serve populations with chronic health conditions or disabilities, in particular from like a mental health standpoint? Is there like a design issue that you're seeing?
I mean, I've heard several things that make all the sense. But definitely, I mean, one thing that is coming to me, and I thank you for giving me the turn to talk, is engaging with communities that are belong to the people with disabilities population, and asking them, like really having like a panel of people who actually are the end of users, and they will tell you, well, this is what and of course, you're asking us because we interact with them, but they have very specific, experiences, and beyond what we can talk about, they might be able, to do it even better. I don't know. For instance, I do know that when I get in the bus and I see that there is like this difference there's like a step where you go to the next level of the thing. That's kind of like, it doesn't look that easy for me to navigate if I was, having some sort of disability. I don't know, the design of the bus, is that really so friendly? Can it be just straight instead of having that bump thing in there? But I think it would be best to engage with these communities, and not only for this, but for anything, this community engagement buzzword that we're hearing everywhere. I think that's exactly where it comes from, like really asking directly, what do you guys think can be? But now from the mental health point of view, just the fact that people are empowered to do stuff on their own, go anywhere on their own, I think that's a big deal. For people to try. I personally did take one of your kind of like educational workshops where you go and you get in the bus with other people, and that was super empowering, because I mean, I can do it on my own, but there is a level of anxiety. And then I brought my daughter in, and that was very empowering. And after that, it was way easier for her to say, yes, I can do this on my own. And this is a child that has never used the public transportation system alone, ever. But after that workshop, she was like, okay, we got a little try. And I, as a mom, I was like, oh, I feel much better because I know what it is about. And if anything, I can try. So I think that's one, one thing that exploiting in a way, like, be empowered of doing this. You can do this, to go anywhere you want. So
yeah,
I'll do the good places, please.
That's great. Yeah, really, that's like that linchpin service, right? Like transportation enables you to like go to do other things, right? That's great. So Sadie, from your standpoint, I mean, I know that you deal with people who might have had falls or other traumatic experiences, but how do you think that public transportation systems can be designed to better serve people either with chronic health conditions or disabilities?
I think, I mean, I think our public transportation system within the city of Boulder does quite a good job. I haven't ridden the bus for a number of years, but you know, my memory of, you know, having benches and you know, having good drainage and you know, relatively flat sidewalks around a majority of the bus stops. You know, I think a lot of them are that way. But that would be my just one thought. You know, I think a lot of older adults, you know, oftentimes rely on public health. That's what I'm finding, or excuse me, public transportation. That's what I'm finding, just being out in the community a little bit more. And so I think just being mindful of people who might you know, need to take a break before they get onto the bus. You know, people, if they have walkers or canes or, you know, how are they going to access and step up and, you know, be able to get to where they need to go. And they might be a little bit slower moving, you know, a higher risk for falling. So I think just being mindful of that is really what I see.
Okay, great. Yeah. So I'm hearing that it's not just like the accessibility of the bus itself, like with the ramp, but it's also like, where do people sit, or do they have shade when they're waiting too? Yeah. I love that. Marina, I see your hands up. Would you like to respond to what
Just a
Sadie
thought.
said?
This is just a thought that came up. I mean, something to maybe think about, and I don't know how feasible this is, but maybe having certain individuals have a special something identifier for the bus driver to know these are people who need support in some way, and instead of they're trying to communicate with the driver. So whatever the disability is, you know, having something that they can show the driver saying, you know, especially I think that many, at least my grandson, you know, they take the same routes over and over, right? Because they're going from home, from and to every day. So I would think that these drivers don't change very often, so they would get to know their community at some point. But just throwing that out there, Angel.
Yeah, thank you.
Because I know my grandson doesn't like to identify, like he needs help. And so he wouldn't actually offer to say it.
Yeah.
He goes around all the ordeals. So I'm just thinking about, is there anything else that we can do for that kind of passengers?
Yeah. And Jessica mentioned the special disabilities discount card, or the special card for people with disabilities. That's where you get the 50% discount on your bus passes as well. And Lisa, I don't know, Lisa Bitzer, I know that you had your camera off, but I don't know if you want to speak to a little bit about Via Mobility Services and the drivers, because you all have like pretty close relationships with your passengers, correct?
Yeah, so door through door if needed, stay with the person till they get to their destination, to make sure that they get into where they need to go if they need that kind of assistance. So it sounds like it could be something that her grandson would be helpful for him. They get to know their riders really well. We are that specialized service that goes the extra mile that sometimes public transportation can't do.
Yeah. And also during the pandemic, I remember Via was like delivering food to your passengers that couldn't leave as well, right? So there was a couple great partnerships where you're bringing food to people.
Yeah, we did with the Boulder County Farmers Market. We even did with the Boulder County Health Department. We delivered food, we delivered medicine, we delivered just about anything that they would need during the pandemic. We still do some food delivery from Community Food Share to some people that are homebound that need to have good nutritional food. So we still do that on a smaller scale, of course. The problem is that there's not a lot of funding right now because COVID is supposedly gone, which it's not. It's still around, but not making people as sick as it was before, at least to a big degree. And so getting funding for those food deliveries is very difficult. But if someone needs that and we can help, please let me know, and we'll try to do everything we can to be of assistance.
Great, thank you, Lisa. So the last person for this question is Daphne, I believe. So what do you think? Like, what role or how can public transportation be designed to better serve populations with chronic conditions or disabilities, or even the people you serve? How can it be improved?
Well, I loved all of the suggestions so far. They're excellent. The only thing I'd add is we've just now started to experiment in WIC with a handheld language translator. So for language access, which can be essentially a special need in our community if people don't speak English or Spanish, and they don't have the access to a lot of the markers and stuff, you know. So I think it just comes, if a bus driver were to have one of those translation devices in case they weren't bilingual, that might be helpful. And I know that's not a special need, but that I'm kind of putting it in there.
Yeah.
I think we had one other idea, Aurora. Wasn't there something else?
Believe it was, so it was a neurodivergent thing, the wig thing, and then having vans to areas of food insecurity and allowing strollers to be set up and not collapsed when they're getting on.
Because essentially I would make an argument that parents with strollers are an invisible disability. It's similar to a wheelchair, right? Because you got the stroller, and because nobody classifies it as such, it doesn't, you know, it doesn't technically come under ADA. However, a lot of the requirements of caring for a couple of toddlers while you're trying to get on a bus are similar. And so if there's things that you all can think of from your purview, because everything you guys have thought of so far is excellent, I just kind of ask you all to noodle on that one.
It does remind me that that thought reminds me of a podcast that I listened to from 99% Invisible, which is all about like how we design things. And it was called the curb effects, right? So the curb cuts that are on the sidewalks were really intended for like wheelchair users, but they really looked into like how they had broader impacts on people with strollers or just like everybody, right? And I do think, and I don't know if Gabrielle wants to talk about this at all, but I think RTD has to have a certain number of ADA spots by the law. And if there's a stroller in that ADA spot, then they might, I don't know, get sued or something. I don't know. So I don't know if you want to speak to that or if that's.
So can you tell me exactly what your question is? Is it
Yeah,
how many
so
spots?
we're talking about like strollers and the like why we have to fold up strollers when we board the bus, and that may not be your area, but yeah.
It's tangential to my area, and that's something that I'm relatively new to the role, and I'm not clear on the reasoning why. I just know that technically that's not something that operators are supposed, I don't know about supposed, but they don't have to accommodate that. That's not an expectation of them. But in practice, if you go to a light rail station, you'll often see parents with small children in strollers using the ADA accessible ramps. It often happens on buses too, though probably to a different extent. So I think there's a gap in the practice and also the between the, let's say, the application of the law and sort of the way that it's written, the policy is written. Why don't I get back to you on that one? That's not, that's something that I wondered just this weekend because I had my little boy with me, stroller, downtown Denver. And I thought, as I was carrying him onto light rail, I thought, this is kind of tough. And my wife would struggle to do this, what I'm doing with baby in one hand and stroller in the other arm.
Yeah, it is definitely, you were kind of cutting in and out, but I think I caught like a majority of what you're saying. So I do think that Daphne, it does have to do with like the number of spaces you have to have designated. Also, like it probably goes back to like how they're ordering the buses and designing the buses, right? Because I know the hot buses, all the seats kind of face in towards each other. So is that a possibility? Like, can we design the seats of the buses a little bit better so it can accommodate strollers as well? Yeah, so I like that idea. Okay, and then it looks like Robert really liked your idea of having the handheld translators for people. So the next question is really about like the cross section between transportation and public health, healthcare industry. Like I think that the healthcare industry is pretty siloed, it seems. I mean, it's like hard to kind of break into that, but like what is one thing that you wish that transportation planners or transportation providers understood about public health or about the healthcare industry so that we can be better equipped to kind of reach out and have those like collaborative conversations? And I'll go ahead and start with you, Lizbeth. So what do you think, like transportation planners and providers, what should we know and understand about public health?
Well, if you ask me personally, safety. Safety is super important. It's what we are all waiting, looking for. That's a number one priority, is keeping the population safe. So anything that can be felt unsafe should be removed. And anything that is not conducive to safety, again, if we don't have it, let's have it. And I was just thinking about your question with chronic conditions, for instance. When a chronic condition becomes decompensated, for instance, or exacerbated or something, sometimes the attention right there in the moment can be the difference between life and death. And these are super simple interventions and can make people feel safe. Like, I am a diabetic patient, and if I'm having some sort of all of the sudden hypoglycemia or the opposite, and nobody knows what to do with me, just having somebody to measure in the meantime while we park, how much is my glucose, so that I know what to do. Maybe I can handle it myself, or we have to call the ambulance, or having the, like a biometer, something to check the blood pressure in there, just to have an idea, is this low pressure, high pressure, super simple procedures. And even having like an EpiPen, like who knows, in the bus, kids sharing the stuff, and oops, all of a sudden one of the kiddos get an allergic reaction. And again, it's super simple interventions. Anything that can kind of like contribute to people's feeling of safety once they are in that, in that kind of like contained space, because it is a contained space and it's not your space. But anything that can be done in the meantime, I think that will be good.
Yeah, great. Thank you. So Sadie, what about you? What do you think that it would be helpful for transportation professionals to understand about your profession?
I'm gonna kind of piggyback off what Lizbeth said. Just the safety, the safety kind of message, just really kind of looking with an eye for keeping people safe as they're planning different, public transportation and different other transportation avenues. The other thing that kind of came to mind with this too is just data sharing as well. Specifically like GIS mapping of, where injuries are happening in our community and how we can work on those areas to make them safer. I know, CDOT and like Vision Zero and their kind of program planning, they look at that a lot, but I also think there's an opportunity to kind of loop in like the hospital system and kind of look at the trauma registry and kind of have a partnership there. CDPHE, they have a lot of great data as well. Just with, where falls are occurring, how many are happening, and not just necessarily the crude rates. I think we can just do a better job at again, kind of sharing the map of where those injuries are happening.
Yeah, wonderful. And it looks like Cammie has a response to our question. She's the Vision Zero program manager for Longmont.
So Sadie, I just love what you just said, everything about that. And I just wanted to share, I think Angel, I'll send you some information, but I know there's some federal legislation that's going to be introduced to ensure that now, from the point of any emergency call, like a 911 call, that accident report number will follow through and match up with a hospital report number, will match up with the EMS report number. So all of this robust data that we all know would be so helpful, but we have to find it from so many different places, put it together ourselves. Like, it's a lot. There's effort at the national level to hopefully make all of that easier. So just when you see that come out, tell your local reps to please, support that, because that'll be a game changer for all of us in the field. And then just the other idea, kind of building on what a number of you have said, is the idea through kind of the Vision Zero lens of doing post-crash care, which I know Boulder County already has a team that goes out afterwards, but I think even for the more local municipalities too, to they're going to be working on those potentially. I know Longmont for sure is, so I might be calling all the level 2 trauma injury prevention coordinators. Would you want to participate? You know, all of that kind of work to really go back out and look at it beyond the lens of what's in a police report that's looking for faults, but what else could be contributing to these problems and challenges and crashes that are fatal or severely injuring. And so I just think there's a lot of momentum with the Vision Zero wave coming on that's going to hopefully be addressing a lot of what a lot of you have said. So it's very exciting. And Angel will make sure that the MAC members hopefully get the announcement about the upcoming local Vision Zero discussions if anybody wants to join those as well.
Yeah, wonderful. We'll include all of those in the follow-up newsletter, and we can forward those as well.
So, but thank you, Sadie, just echoing good thoughts, all good.
Thanks. So Daphne and Aurora, what are, do you all have anything that you wish that transportation providers and planners like understood about your job, about your profession?
One thing that I'll throw out there based on the conversation we just had is just for general awareness for y'all to know that with Boulder County Public Health, we're working with our IT department on a heat map project right now. And so this idea that that you have, Sadie, of mapping the crash stuff, we could actually probably enter an MOU and work on that. And the rest of the folks on here, the county had already created a vulnerability index that's already out there and publicly available. What we've been working on is a resiliency index, an opportunity index, like what creates resilient communities. I do believe transportation has a huge role in resilience of communities. And so the one thing I'd put out there is just appreciation for you all. And, you know, we're happy to partner with anyone who might want to explore how heat maps or mapping certain things could help us have data-informed conversations or solutions that that make sense. And with that, I'll pass it off to Aurora.
Thank you, Daphne. Pretty much everything has already been sort of said. Just kind of remembering that the buses are not infant friendly. So like, you know, when people are shopping and they're carrying their bags and they have infants and the stroller, you know, back to the stroller conversation. I think earlier we spoke about partnering with school districts. Perhaps the bus drivers can do the food run type of efforts in the community. The other thing too is helping households maintain their maybe they have one good vehicle and maybe you know, they would need like winter tires or making sure that mechanically the car is in working order, and then help the rest of the family take the public transportation or some other kind of transportation efforts. And in regards to children with special needs, I would just kind of echo what I said earlier about making sure that the buses on the inside, they have like the working visual aids, working auditory aids, making sure that the button to stop the bus is actually working. And I've seen sometimes when I used to ride it that it wasn't working. And so you had to like go up to the bus driver and say, this is my stop. So that kind of sort of created a little bit of a safety hazard. But just thinking about making sure that, you know, they have the flexibility. And like Marina said earlier, you know, maybe having a little bit more flexibility or comprehension of like those that have invisible needs and who might need a little bit more time getting on or getting off for the bus for that.
Great, thank you. So I know we're almost to the end, so we have like one final question, just like short. If you had a magic wand and you could fix one thing, or you could like create one thing that would help with transportation, public health access, what would that be? And we'll go ahead and start with you, Daphne.
Yeah, for me, the magic wand would be a bonus fund for car repairs and snow tires, so that each family or pod of families could have at least one working vehicle, because we do think that would actually help the rest of the family access more of the public transportation, because we just see that phenomenon with our families that we serve, that the person who's got a job leaves in the morning and then doesn't come home till the evening. And so, but it affects the entire family finances. So looking at the ecosystem, looking at the community, that the bus as a community asset is would be helpful to us.
Yeah, so acknowledging that like we're still car dominated, right? And so some
Yeah.
people still do need cars, right?
And so a partnership there could be really helpful of
Yeah.
some sort, because there are no repair, there are no car repair funds out there, and that's a real vulnerability for families.
Yeah, thank you. What about you, Aurora? You have one magic wand. What's your one wish?
So for us, just based on the feedback that we got from our families when we were doing care coordination with children with special needs, is just to have an improvement on the human centered communication. So when they're like calling via or access a ride or something like that, making sure that there is a human available to talk to instead of a bot, because oftentimes they would say they would get stuck on the bot and they couldn't get to where they need to if they needed to cancel a meeting or an appointment, but then they couldn't. And so they were just kind of frustrated with the system. So for me, it would be fixing it or improving it so that they can at least get to someone if they need to get to someone without having to jump through all the numbers when they're giving.
And then Aurora, you mentioned before, then they'd lose the ability to create future appointments, right? Because they'd missed one that they hadn't called in for, but it wasn't that they hadn't called in, it's that there wasn't anyone to help actually hear their cancellation.
Correct, yes.
Maybe that's improved recently, but
yeah, I'm not sure if this has improved after the pandemic, but I know that prior to that, our families would, if they had too many cancellations or no shows, then they wouldn't be able to ride the the transportation anymore.
Yeah. Okay. That's good. Lizbeth, what's your like one wish with your magic wand? What would you change?
Yeah, probably would be before doing anything, consult with the people who need it the most, not the people who oppose it the most, but really to the people that need it the most, and bring a lot to the community, and just stick with the plan. We're gonna do what serves the most, to really listen to the growth, because that's what is happening. So yeah, just really listen to the people and do it following the advice.
Yeah, and it's that saying, nothing about us without us, right? Like making sure that you're doing those check-ins with the people who are using your system. Yeah.
Yes.
Yeah, that's great. And then Sadie, I believe you're the last person. What's your magic wand wish?
I think I have two. So one is just ensuring that all patients that need transportation to health appointments or accessing healthcare in general, that they would be able to access the services that they need at the time that they need it. And then I think the second one really just is safety. And I think honestly, it's just the Vision Zero slogan. Like I would just like to see, zero deaths and, zero serious injuries from motor vehicle crashes and bike crashes.
Great, thank you. Jessica, did I miss any questions in the chat that you want me to circle back to, or?
No, some people have very good insights. There's some information about right now. I talked about the RTD special discount card and also how to apply to access a ride. Gabrielle had some information about stroller, so he followed up about that. And then Joanna had a very nice paragraph about the importance of having inclusive transportation and considering access to health when we think about transportation.
Great.
And Cami mentioned information about a woman's work to help people with car repairs.
Great,
So,
thank you.
I think so. Yeah.
Yeah, and Marina, I see that Marina also just put a comment that youth disability differs from senior disability. Yeah, and I think sometimes there's, people are born with disabilities or they have acquired disabilities, right? And so that also is a little bit different approach as well. That's a good point. CPWD does have a youth support group, I believe, Marina, if you haven't connected your grandson with that, but that's a great resource in the community. I think we're coming to the end. I just wanted to remind everybody that next month we're going to be in person in Boulder. So we will be focusing on starting to look at our work plan, what we want to focus on next year, really trying to get our goals aligned with what this group can focus on. So I hope everybody's able to attend in person. We'll have some snacks and it'd be nice to see everybody. But thank you so much to our panelists for taking time out of their day. And I know like it was last minute ask for some of you, just trying to like reach out to anybody in the health industry. But thank you for your time and thank you for your really insightful responses. We appreciate it. And thank you. Keep in touch.
Thank you so much.
Thank you so much.
Thanks for all
Angel.
you do.
Thanks, everyone.
Thank you in person on October 15th.